The following segment is sponsored by Wasatch Medical Clinic. Get back in the bedroom with Wasatch Medical Clinic. Andrew's here to tell us about a new treatment for ED. Welcome back, Andrew.
Thanks for having me. Good.
It's always good to see you, man.
Good to see you.
How are things with you?
We are good. Very busy.
Super busy for sure. Now, this new treatment, how does it work?
Well, this is for erectile dysfunction, or ED.
Yes.
What it does is it delivers pressure waves. It's called acoustic wave therapy. The pressure waves repair and open up blood vessels.
Gotcha.
One of the leading causes of ED is damaged blood vessels and restricted blood flow. There you can kind of see on the left.
Yep.
Then what our treatments do on the right, it opens up everything, improves circulation, and men get relief from the pill. They get the spontaneity and the normal blood flow restored.
Gotcha. And are the results permanent?
I would say long-lasting, probably not permanent, but data has gone back to men many years after getting the treatments. The results are still there. So unlike the pill, it's not something you have to typically repeat.
So you mentioned other treatments are out there. So the acoustic wave therapy, how does it signify different than any other treatment that's out there?
Everything, pretty much everything, for 30 years has addressed the symptoms of ED. That's the pill, maybe injections.
Right.
You become a prisoner to it. So you're taking it the rest of your life. This goes to the root cause problem of erectile dysfunction. It restores the blood flow. So that's the big difference. Instead of a Band-Aid, we're going to the actual problem.
Gotcha. So ED, does it get better on its own maybe over time? Can it fix itself?
Well, I compare it to our eyesight or hearing. Once it kind of starts to fade, it generally doesn't correct itself on its own. You change your diet and you think it will get better. Unfortunately, it doesn't. You need to take action, something like the wave therapy, to actually correct the problem.
I gotcha. Now, is ED something that's going to affect all men over time, or is it just a certain demographic?
Well, I hate to say it, but I believe all men will get ED at some point in their life. They say 50% of men get it.
Really?
But there are a lot of men suffering in silence, so I've never believed that stat. It's coming for all of us, guys.
So if someone's out there who is struggling with ED, what's the best thing that they can do? Just call Wasatch Medical Clinic.
I would say set up a consultation with our doctor. That's the best thing. That doesn't mean you have to take treatments, but you can talk about it. You can ask questions, see if you're a good candidate. We'll test your blood flow, and then you can go from there.
And if someone calls, they go in for that consultation, what's the first thing they can expect? What's that like?
It will be just a quick medical assessment with our doctor. The doctor will test the strength of blood vessels to see if the ED is a blood flow problem and not something else.
Okay.
And then you can decide if you want to proceed with treatments.
Awesome. And now the treatment, does the average man need it in order to fix the problem? Is that what you've seen over the years?
Yeah, typically, yes. They'll need it, and they'll need a few 10-minute sessions, generally done over about 2 weeks. That's it. That's the whole process.
Short period of time.
It is a short period of time.
That's really cool. Now, your staff, this is a question that comes up. Is it all men that's in the staff, or
it is? It is an all-male staff. It's a discreet and confidential environment. Men think this sounds pretty embarrassing and intimidating. It's not. You'll be more comfortable than you think.
Yeah. Now, so if someone is nervous of picking up the phone and calling Wasatch Medical Clinic, what is the process? What can they expect? They're going to contact super nice staff?
Yep. They'll come in. They'll meet with our male medical doctor, about a 25-minute consultation. Then, if you want to go forward with treatments, you proceed. The device is placed on the skin, not invasive or painful, zero recovery time of any kind.
And where we're going for more information is right here on the screen, wasatchmedicalclinic.com. Anywhere else?
That's right, wasatchmedicalclinic.com, or call that number and we'll do the consultation totally free.
All right, fantastic. Andrew, thank you for coming in, and good luck.
Thanks for having me. Appreciate it.